Okay. Good morning, class. As you know, I am Dr. Ambarish Ghosh, Department of Psychiatry. Today I will take the class of Introduction to Psychiatry and some history about psychiatry. Okay? Psychiatry. The term psychiatry was coined by Christian Rale in the year 1808. Before that, Benedict Morel had coined the term dementia precox, which he introduced to say all the patients of psychiatric patients were under dementia precox. Actually, if you see in the history of psychiatry, the very first book which had dealt with all the psychiatric problems and had been written there was Charaka Samhita, which was written in the year 3rd BC. Even the Greek philosophers and physicians at that time used to had said our deterioration paranoia, these were all being dealt with Greek psychiatrists or philosophers. I think you have heard the name Hippocrates. Hippocrates had coined the term melancholy. Which you will know what melancholia is in later classes. He had once told that he had gone to meet another physician by the name Democritus, and found that Democritus was in his garden cutting animals. When asked, he said he wanted to find the origin of melancholia and the origin of psychiatric illness, and he thought at that point of that time, it was in AD, some 3 or 4 AD, that it was from the inner boils or inner organs which caused these mental problems. Now, I think you all know about Ojha, Bhoot Tarano, and which is prevalent even now, right now, which we'll call as, we might have heard, we all have heard about the term exorcism. I think you all have heard about ghost stories. हम लोग बचपन में we used to ask, we used to feel enthralled to listen about all ghost stories. But in truth, what we call psychiatrists, we call as parapsychology. Even great men You all can think about some, what will I tell you? Swami Vivekananda Guru. Have you heard of this person? Ramakrishna Paramahams. And other devotees who had a regular vision of God. And people who see ghosts in areas like in the churchyard, graveyard, all haunted places. And these gods, these are all dealt under psychiatry. You might call him an angel, a paramahams, but as a psychiatrist, we might call him a schizophrenic. That's the difference between how the normal general population look at people like this and how we psychiatrists perceive people as Ramakrishna Paramahansa or all these people who sees ghost and God and gets to talk about them. I would say in my post-graduation time, I had come across a patient. She was an 88-year-old female patient. I still remember quite vividly because it was a very unique case. Her husband had brought her to our OPD. His complaint was that few months back, around 3 to 4 months back, his wife has suddenly started having visions of Lord Shiva coming and visiting him visiting her in her dreams. Slowly, these visions came very normal even in the mornings and evenings. And that Lord Shiva used to have a direct interaction with his wife. Later on, but that was not the reason why he brought his wife, because he was pretty happy because he thought that his wife is attaining moksha, or his wife is such a person that she will obviously go to heaven in his but why he came down? He came down to us because according to him, this Lord Shiva had instructed his wife to only speak with him and not to speak with other human or any human being. So she just became mute. This is a word which will come across psychiatry, and she had stopped interacting with anybody. On further evaluation, and we did our EEG and routine tests like MRI and all scans, found out there's no abnormality. But there was a little bit cortical atrophy only, which is known as diffuse shrinkage of the brain, maybe due to age or maybe due to dementia. This is known as diffuse shrinkage of brain. Later on, this woman was treated with antipsychotics and donepezil for dementia, and apparently it was a very sad case. Why? Because after 20 days of treatment, not miraculously, which is like an act of the devil by us, that these visions of Lord Shiva, apparently these apparitions of Lord Shiva decreased in the female patient, because of which she and her husband both were agitated towards us. Obviously, for him, his wife is already moksha. his wife is going to the heavens. And we, infidels, we stopped her direct interaction with God. So they took a DRV and the patient went back home and we never saw the patient back. Sad story. While, what about ghost? I think you all have seen this movie. Bhool Bhulaiya. I did get a patient of the same thing. I think Bhool Bhulaiya or whatever spelling is. I did get a patient who also had this same traits like this Vidyavaran. She was diagnosed with schizophrenia by me. She was an engineering student from Bihar. She was hailing from Bihar. She came down. She had a very unique history. The history being, when she was not born, her great grandfathers daughter-in-law was apparently killed for dowry death by her mother-in-law and her husband when she was not even born. But when this girl was born, apparently born, and then when she was in ninth standard, people saw her talking in the tone of this woman who had expired long before she was born, and tell the whole history of this daughter-in-law's life, and even telling that she didn't commit suicide but she was killed by her mother-in-law and her husband. This patient came down to me when she was studying engineering, and apparently after being treated by me, she went back to her normal life, and good for her that she has stopped all these visions. So you can say psychiatry also deals with God and devil and all these superstitions which we had. For your interest, I will tell you about this hospital. I think you all can check it on Wikipedia. This is a famous psychiatric hospital in Australia by the name Aradale Mental Hospital in Australia, which is one of the most haunted places in the world. Apparently, why? According to people, they say the atrocities and the torture dealt on psychiatric patients at that time was inhuman, and these people, when they expired, they became ghosts. I don't know how much of that is true, but yeah, the torture was true. Earlier, psychiatric patients were dealt with. They used to be submerged in water for hours in water, chained. Even beaten up. They were kept in the worst conditions with no sunlight, and even putting that much as an iron mask on the face with pointed needles. they were also treated, they were never treated, they were actually institutionalized and kept away from the general population. But the population thought that these people were either been cast by the devil, and they ceased to be inhuman, and that's why they were actually kept as far away from the general population as possible. But this all changed when George III the British monarch was diagnosed with a mental illness. Bad. At that time, the King of England suffering from a psychotic breakdown. Very difficult. But apparently he was treated and he went into remission, which was good. And this led to the thought that maybe, just maybe, the psychotic patients can be treated. Later on, there were a lot of discussions held, and it was realized that this is all because of the brain and nothing to deal with any extraterrestrial or beings or the god or devil. And because of which proper hospitals, proper mental asylums were built to treat the psychotic and the neurotic patients. You should know the term, know the person. Jean Baptist Pushin. Jean Baptist Pushin was the the physician. The first physician who unshackled the chains which used to bind the psychotic patients. He stopped the torture of psychotic patients. Rather, he introduced straitjackets to control the violent behavior of the psychotics, apparently. This is the history of the early 19th century. Later, the father of psychoanalysis, Sigmund Freud, was born in Czech Republic. Sigmund Freud moved to Vienna when he was 4 years of age, and his father was a wool merchant. So Sigmund Freud became a physician, and he was very much interested in all this psychiatric patients and parapsychology. He moved to France to study psychiatry under Jane Piaget, I think, to learn hypnosis therapy. We are very much accustomed to hypnosis therapy because we have seen in the movie Sonar Killa. At that time, hypnotic therapy was used extensively by Jean Piaget to treat hysteria. If you can, I would all suggest you to watch this serial Freud, which is on Netflix. There are 8 episodes. You should know what hysteria is and what was dealt at that time in the late 19th century, in the year around 1872 or something like that, 1870s, where there is no medication, no ways to treat any psychiatric patients, but there is so much rampant hysteria and psychotic moria, mainly because of the suffocation of the church, suffocation of the religious instinct, and the suffocation of what I feel the word termed as basically free will. People were bound under a lot of customs, lot of family obligations, lot of society governed rules. Basically the house wives and the females of that time, when burdened with a lot of psychiatric problems, had sometimes become hysteric, pathetic to see at that time, when people used to think that hysteria is a devil's act on the woman, because women were vile at that time. All religion, be it Christianity, be it Muslims, all Muslim religion, most of the religions, they had demeaned the females, and the females were bereft of that independence and their rights. They had all these inner urges, the needs, which when not fulfilled, turned the patients into hysteria. It was a great thing, like in a classroom, it was just a spectacular sight to see all physicians standing all over in a hall, commenting, seeing a female of hysteria who at one point of time was impossible to be held in that room, kept hold by 4 or 5 people, but later on, under hypnosis, the patient apparently became all right. It was pathetic. It was almost like magical. So Sigmund Freud was so much impressed by that, he went back and set shop in Vienna and started to deal with all these hysteric patients and tried to treat them with hysteria, with hypnosis therapy. Then the famous patient was transferred to Sigmund Freud by Breuer. The patient name is Anna O, the name given. This changed psychiatry. I don't think you should need to know more about her because that's all postgraduate. But we should understand why. Why do we need to study psychiatry? Not only to be a good clinician, no. But we need to know psychiatry and psychology. Psych means mind. Art means study. So we need to know psychiatry and psychology to be first a better human being, and to know how to better deal with other human beings too. Psychiatry, psychology, they give explanation to each and every action, what we do, what we think, and how we perceive life. There is all an explanation in psychiatry. At least we try to. That's why they say, when nobody can treat you, come to a psychiatrist. The psychiatrist will obviously diagnose you and even treat you. To understand that, we study the mind, the brain. The brain is consists of nerves. There are over 1 billion nerves in the brain. In turn, the nerves are made of neurons. There are over 1 trillion neurons in the brain. Each neuron has approximately 6,000 connections. So, the neuropsychiatrists, neurobiologists have deciphered there are over 10 to the power 1 million connections in the brain. Such is the vastness of psychiatry, the brain. And in the following classes, I will teach you how to decipher the most intrigued substance in this earth, that which differentiates us from animals and others. Thank you.